Migraine headaches have triggers. Sometimes the triggers are obvious.
Okay.
I'm going to give you this so you don't
Oh,
have to
okay.
take
So I have to have my glasses.
One of the common triggers are lack of caffeine. I know some people who drink caffeine, not just coffee, but tea and sometimes pop. And then when they go to bed, they don't drink, of course, and they wake up in the morning with a headache. They drink a strong cup of coffee and the headache goes away. So they tell people who are migraineurs not to drink caffeinated beverages. However, if there's no connection between caffeine and not, you don't have to worry about it. Do you drink coffee and things like that?
I drink diet pop, and most of the time at home I drink with no caffeine. If I'm out, you know, in the day, you can't
Well,
get that.
sometimes that happens, of course, is headaches in the morning. So there are some things, and this is a list of things that most people with migraines are told about, that monosodium glutamate, which is, we thought, just Chinese food, but it's in most prepared foods. Almost all prepared foods, unless it says no MSG, has it. There's some strange things, like it's not chocolate that causes migraine headache, but a phentolamine breakdown product of chocolate that takes 2 or 3 days later. So you may not realize that you had chocolate 3 days ago and now you have this migraine. Strange things like avocado, bananas, sometimes citrus fruits can cause it. Everybody knows that alcohol, particularly red wine, can do it. Many people feel that NutraSweet aspartame may do it. So here's a list of some things. I also know that if there's a change in ambient temperature of more than 10 points or a change in barometric pressure of more than 4 points, it can precipitate a migraine headache. It also happens when people tend to oversleep, when they miss meals. And you know, it's not really stress-related per se, but the absence of stress. I had a minister several weeks ago that his migraines were on Monday. Let me give you this list, and if the shoe fits, wear it.
Okay.
While you're waiting to wear the shoe, I would like you to take 5 grains of aspirin in addition to your white willow bark.
Okay.
Now, this is not enough to upset your stomach. It's not enough to get rid of your headache. It's a small, small dose. But why I'm giving it to you is that your platelets, these are the formed elements in your blood, contain little packets of serotonin. And when people start getting a migraine, the serotonin is sometimes released from the platelets. And migraineurs have a higher amount of serotonin in their platelets, so it gives amplification to their headache. And 5 grains of aspirin a day, that's 1 aspirin a day, will keep the headache away, so it's said.
Okay.
Not that you really need this, but let me prepare you should it happen, is that there are some medications that only work on migraine. You may have heard, like 20 years ago, yeah, I think Imitrex just came out 20 years ago, that Imitrex works, and I'll give you a script for just a few of them to try, but it works better if you take naproxen, and that's related to the lousy ibuprofen. And naproxen, 500 milligrams, and Dr. David taught me that Aleve contains 240 milligrams, say, to Aleve.
Okay.
More than that, I'll give you, or he'll give you a prescription for a drug called Raylan. And the 10 milligram size, you take half of one. You take all these together. And even though you may not have a bad headache and you think that you can go through it by yourself, if you take this and it gets all better, much better than taking the ibuprofen before, it leans us towards that direction that you're really having a migraine. 1 or 2 other things to tend to prevent the migraine. There are some natural things. Magnesium, and Dr. David will tell you about magnesium in the form of calm, feverfew, butterbur, and a vitamin, riboflavin. But if you do the riboflavin, you have to take enough of them, 400 milligrams. Dr. Robbins. So, this is my migraine spiel.
Okay.
So we'll do the blood test on her, and I use